Mr. Minister and staff, first of all, I'd like to say a warm and friendly welcome to you, to the town of Montague on behalf of the town council and all the residents. It's a pleasure to have you with us this evening. I want to also say at the beginning that everything I've heard so far sounds perfect, but it's not a perfect world by any means. And having said that, Mr. Minister, Montague had a hospital during the First World War. We had a new hospital built after the Second World War. We had a new hospital built in 1970. And since then, we've lost a lot of services, and the people here don't want to lose any more. So I want to be as gentle as I can with you, Mr. Minister, in saying that. We've lost, since 1970, we've lost the surgeons that we've had, we lost the maternity wing, we lost the dialysis, and we've lost the 24 emergency. So we've lost 4 things over the last 30 years, and we do not want to lose any other services than we've already lost. This evening I want to say that we in the town of Montague and surrounding areas had many concerns over the recent announcement of the changes to the Ireland health system, and we need more details about our own Kings County Memorial Hospital. We are concerned that in 2013 in 2023 we'll have less services than we have today. I like what I saw this evening. The presentation is well done. You are providing new things for the future, and that's good news. But at the same time, we are worried about the Kings County Memorial Hospital. It's been here since the beginning of the First World War. We've had a very busy town. We've had 14,000 cars cross the bridge every day. We're a busy service center. We're a busy community, and we need and want a hospital. We at least want one hospital in Kings County. If we lose one, we don't want to lose 2. My question, Mr. Minister, will Kings County Memorial Hospital have your assurance that it will continue to provide acute care and emergency service at the present level for Montague in this region of Kings County?
Healthcare has evolved in this province, and I know that in various communities there was babies delivered, there was surgery being performed, and over the last 20 years I think we've seen a constant evolution of how healthcare has been delivered. So certainly our government sees this facility here in this community as a key asset. Obviously, as you see, not much has changed or will change. The services that we wrap around with the telehealth and the rapid response vehicles hopefully will continue to serve the community, plus as well as the investments in primary health care. So certainly our government's committed to the services that are here, and we really, as I've said before, in communities all across Prince Island, we need to make sure we're providing quality services at the appropriate time in the appropriate situation. We need to keep people out of acute care beds. And how do we do that? We need to make sure that we're providing services all across the province. We recognize that the population is aging, and we need to manage that aging group, the baby boomers that are between 50 and 70 right now, and the chronic disease, and keep them in the communities and manage them as best we can. So, thank you.
It's great if we can all wait till 8 o'clock in the morning or before 10 o'clock at night to get sick. But unfortunately, that's not the way it happens. I'm looking at the manager of the ambulance service here. If you're living in Surrey or in Murray Harbour or Montague, and you're expecting the ambulance to be your savior, you better have plan B, because it just doesn't work.
There are times, sir, within our communities where our vehicles are roadside, and sometimes that does mean that we're covering multiple areas. But one of the great things with the provincial system is it actually gives us units to be able to do that. If we were covering this specific area and we didn't have any additional units which we could pull in, And there are times, because I have worked in private services, where all of your vehicles are on emergency calls. This gives us an ability to pull vehicles from other areas when they're not on calls. The addition of these 3 units is going to have a large impact, not just here in Montague, but across the island, because it's going to add additional resources into the system. And specifically, the rapid response units are going to make it so that within the communities, there's going to be a vehicle available at all times to respond to calls. So, yeah.
Work in the system, see the system, and don't believe in the system.
I'm sorry you feel that way, sir. I mean, we really try and provide a quality service to the communities. Unfortunately, no company can staff to have an ambulance in every street corner at every time when a call can happen. I will admit these new additions are going to improve Surrey specifically. Surrey, when with the low call volume within Surrey, unfortunately, when a high majority of calls happen, sometimes we don't always have a unit available at that particular second.
Your fast response vehicles, are they 24/7?
No, they're through our daytime hours, 9 hours a day, through our peak times. So they're going to be adjusted based on the communities for that call volume. So within the east, the time of day start time could be different than the west because of the majority of when the calls happen.
My parents had to call 911 for me. The fire department came first to help me, and it took a really long time for the ambulance to get there. I live in Little Pond. Mr. Curry, I have gone by ambulance more than once in the last few years, but this time it really scares me because it took so long. Mr. Curry, could you please help me so that it doesn't happen again? I'll ask you to respond to that.